The most important thing in neurosurgery or neurology is awareness, because lot of diseases which are happening to you, you don't realize that it is there. Many patients come to us at the later stage कि ब्रेन ही है जो आपको पूरा कंट्रोल कर रहा है, आपके हाथ पाँव को, आपके बातों को, आपके सोचने को, आपके बिहेवियर को, आपके यूरिन कंट्रोल को, आपको बॉवल को, मोशन को, मतलब बॉडी में जो भी चल रहा है वो ब्रेन ही है, वो कंट्रोल कर रहा है. एक बेसिक डिक्टम है, एनी डेविएशन फ्रॉम योर रूटीन लाइफ इज अ सिम्टम. आप शब्द याद करने के लिए अड़खड़ा रहे हो, अगर उसके साथ सरदर्द है, उसके साथ गिडीनेस है, ये दो सिम्टम्स अगर आ रहे हैं तो डेफिनेटली ये कोई तो अलार्मिंग साइन है. तो एनी डेविएशन फ्रॉम यूर रूटीन लाइफ यू शुड थिंक दैट इट इज अ अलार्म. ऑप्शन ऑफ ट्रीटमेंट, मल्टीपल ट्रीटमेंट ऑप्शन, नॉट इनकी एक ही ऑपरेशन, ये एक ही इलाज नहीं है, उसमें देयर आर लॉट ऑफ थिंग्स व्हिच कैन बी डन.
सो सर्जिकल एंड नॉन सर्जिकल
डेफिनेटली देयर आर मल्टीपल ऑप्शंस. ओल्ड एज है, यूरिन पास हो रहा है, इम्बैलेंस हो रहा है, मेमोरी डिस्टर्बेंस हो रही है, ये तो बहुत कॉमन सिम्टम्स है ओल्ड एज में. लेकिन क्या मेरे पापा 2 महीने पहले ठीक थे और अभी ये सब चेंजेस रिसेंट हो रहे हैं? अगर ये ड्रास्टिक चेंजेस है तो यू शुड ट्राई टू डायग्नोज. न्यूरोसाइंसेस मींस ओनली ब्रेन. तो यहाँ पे एक समझने की जरूरत होती है कि इट इज नॉट जस्ट अबाउट ब्रेन, इट इज अबाउट स्पाइनल कॉर्ड, नर्व्स एंड द मसल्स. सो ये कंप्लीट सर्किट होता है कि एक चीज दूसरे थ्रू को कंट्रोल करती है, दूसरे से तीसरे पे जाती है.
राइट.
तो एज ए न्यूरोसर्जन और न्यूरोलॉजिस्ट दे see the diseases associated with the brain, spinal cord, nerves and the muscles. So sleep disease is a whole big topic. Again, why sleep disease has increased now just because of the use of laptop, computers, no sports.
Correct.
The ground sports, back becomes weak.
Diggiverse podcast के इस एपिसोड में आपका स्वागत है. इस एपिसोड में हम ऐसी दुनिया में एंटर करेंगे जो मेडिकल साइंस ने भी अभी तक पूरी डिस्कवर नहीं की है, न्यूरोसर्जरी. इस टॉपिक के बारे में बात करने के लिए हमारे साथ जुड़े हुए हैं सोलारिस हॉस्पिटल के फाउंडर डॉक्टर अमित आइवाले सर. उनके साथ बातें करेंगे कि हमें सपने क्यों आते हैं, हमारी मेमोरी कैसे बढ़े, हमारे बूढ़े माँ बाप जिनको मेमोरी कंट्रोल नहीं होता, जिनका ब्लैडर कंट्रोल में प्रॉब्लम है, लोकोमोटिव फंक्शन में प्रॉब्लम्स है, इनको कैसे टैकल किया जाए, बोथ सर्जिकल और नॉन सर्जिकल वे में. क्या आप एक्साइटेड है? तो आइए देखते हैं इस पॉडकास्ट में इन सब के ऊपर क्या सोल्यूशन है. Dr. Sir, welcome to the show.
Yeah.
Thank you so much for coming in. I know you're very busy, and the hospital that you have founded along with your brother, Solaris Hospital. Solaris Hospital is one of the greatest hospitals that we see right now in Thane, which is our own city, big city. And you have won several awards and accolades for the great work that you're doing in the field of neurosurgery and neurology. So I want to understand what are the challenges that you faced when you're growing up. How did you decide to take neurosurgery as a stream?
So as a human being, everyone wants challenges. In my residency during the MBBS, I saw there are physicians, there are surgeons. So surgeons who do the complex surgery and they have a different environment in the operation theater, and that attracted me during my MBBS and residency.
Okay.
Then I went to general surgery. In general surgery, I saw a lot of departments like abdomen, lung, brain, ortho, gynec, all these departments who deal with the surgical aspects.
Right.
But again, the brain is undiscovered
and very
complex. So that attracted me. No, something challenging, that something I should go in and have a take. I can do this.
Yes.
And I want to do better in this field where there is need of innovations and need of better results in the future.
And people, I think, बहुत सालों से ऐसा था कि किसी कुछ दिमागी हो गया तो अरे तो पागल हो गया, ये वाला कहने की हमारे समाज में पूरे पुरानी कहावत है. बट देन नाउ द वर्ल्ड इज चेंजिंग एंड पीपल आर एक्चुअली काउंसलिंग, पीपल आर गोइंग टू न्यूरोसर्जन्स, इवन साइकोलॉजिस्ट फॉर दैट मैटर, एंड बेसिकली गेटिंग ट्रीटेड फॉर एनी न्यूरोलॉजिकल डिसऑर्डर दैट दे हैव. तो आप how do you see this change that is happening in the society, sir?
So the most important thing in neurosurgery or neurology is awareness, because lot of diseases which are happening to you, you don't realize that it is there.
Yes.
Many patients come to us at the later stage बिकॉज कि ब्रेन ही है जो आपको पूरा कंट्रोल कर रहा है, आपके हाथ पाव को, आपके बातों को, आपके सोचने को, आपके बिहेवियर को, आपकी यूरिन कंट्रोल को, आपको बॉवल को, मोशन को, मतलब बॉडी में जो भी चल रहा है वो ब्रेन ही है, वो कंट्रोल कर रहा है. बट ये बावजूद भी हमें पता नहीं होता है कि अगर सर दर्द हो रहा है तो बोलते नहीं आज ज्यादा काम कर लिया, सर दर्द हो गया. नहीं नहीं, आज उठने में रात को लेट हुआ इसलिए कपड़ों में मोशन कर दिया. मेरे पिताजी ओल्ड एज है, वो ओल्ड एज हो गया इसलिए चलने में बैलेंस जा रहा है. तो हम ब्रेन से रिलेटेड जो भी डायग्नोसिस होते हैं या फिर सिम्टम्स होते हैं वो बहुत निग्लेक्ट करते हैं. और इसी के वजह से जो डायग्नोसिस नहीं होता है तो ट्रीटमेंट नहीं हो पा रहा है.
राइट.
तो अभी अवेयरनेस हो रहा है नए जनरेशन में, अवेलेबिलिटी ऑफ टेक्नोलॉजी, यूट्यूब, ये अवेयरनेस बहुत बढ़ चुका है. और पब्लिक आजकल खुद से गूगल करके डिजीजेस को डायग्नोस करके आपके पास आ रहे हैं, सर ऐसा ऐसा सिम्टम्स है, क्या मुझे ये हुआ है.
बट ये कितना सही है सर?
सी टेक्नोलॉजी का सही इस्तेमाल करना जरूरी है, रॉन्ग नहीं. तो अभी जो दुनिया है वो एआई की तरफ जा रही है. सो एआई इज नॉट समथिंग व्हिच इज टू बी स्केयर्ड ऑफ, इट इज आवर फ्रेंड एंड वी हैव टू हैंडल इट विद केयर. सो टेक्नोलॉजी हमें हेल्प ही कर रही है.
सर ये टेक्नोलॉजी और एआई इनटू न्यूरोसर्जरी ये एस्पेक्ट हम लेटर पार्ट ऑफ द इंटरव्यू जरूर आएंगे. लेकिन अगेन कमिंग बैक टू द बेसिक थिंग्स, यहाँ पे ये सिम्टम्स आपने बात की कि हेडेक हो रहा है या फिर कल थोड़ा स्ट्रेस ज्यादा था तो इसलिए बॉडी कंट्रोल नहीं रहा. व्हाट आर द बेसिक सिम्टम्स? ये इसके अलावा क्या सिम्टम्स हो सकते हैं जिसको जो प्रोलॉन्ग कंडीशन में आपको अगर होते हैं तो अ पर्सन शुड गो एंड कंसल्ट अ न्यूरोसर्जन?
सो एक बेसिक डिक्टम है, एनी डेविएशन फ्रॉम योर रूटीन लाइफ इज अ सिम्टम.
ओके.
एनी डेविएशन मीन्स नाउ यू आर डूइंग अ पॉडकास्ट, यू आर अ टॉकिंग पर्सन, अगर आप बात करते समय फंबल हो रहे मोर देन रूटीन,
यस,
आप शब्द याद करने के लिए अड़खड़ा रहे हो,
यस,
अगर उसके साथ सरदर्द है, उसके साथ गिडीनेस है, ये दो सिम्टम्स अगर आ रहे हैं तो डेफिनेटली ये कोई तो अलार्मिंग साइन है. तो एनी डेविएशन फ्रॉम यूर रूटीन लाइफ यू शुड think that it is an alarm.
And if it happens repetitively,
then definitely. मैं एक केस बताऊंगा यहाँ पे.
जी बिल्कुल.
Very known personality, I will not name him, but his job was to address gatherings.
Okay.
And he was so fluent in his speech. एक दिन वो बोला कि मुझे लास्ट 2 दिन से मेरे स्पीच में शब्द नहीं मिल रहे हैं,
याद ही नहीं आ रहे.
कुछ शब्द ऐसे थे कि जो मैं रूटीनली यूज कर रहा था लेकिन मैं वो ये शब्द याद करते समय अड़खड़ा रहा था. और जब हमने उनको इवेल्युएट किया, ही हैड अ माइनर स्ट्रोक ऑन द लेफ्ट साइड ऑफ द ब्रेन. अभी हमारा लेफ्ट साइड ऑफ ब्रेन जो है वो हमारा बात करना, हमारा स्पीच, हमारा कॉम्प्रहेंशन, वर्ड फाइंडिंग एंड इवन हमारा इंटेलेक्चुअल मेमोरी स्टोर करने का इंपॉर्टेंट लोकेशन होता है. और उस जगह पे अगर ऐसा कोई स्ट्रोक आता है तो ये सिम्टम्स आ सकते हैं. तो कोई भी सिम्टम्स निग्लेक्ट नहीं होना है, लेकिन अगर वो रिपीटेटिव है और वो कंसर्निंग है तो यू शुड डेफिनेटली इवैल्यूएट दैट.
राइट. सो वन मोर क्वेश्चन रिगार्डिंग दिस सिम्टम. सो डेविएशन आएगी, सिम्टम्स आपको दिखेंगे, रिपीटेटिव रहेंगे, तो यू शुड डेफिनेटली बी अलार्म्ड अबाउट क्या हो रहा है हमारे साथ. बट बहुत सारे लोग जैसे आपने कहा कि गूगल कर लेते हैं, सैराडोन ले लेंगे, कुछ पैरासिटामोल ले लेंगे, लगेगा कि ठीक हो रहा है. बट इट्स बेसिकली जस्ट अ सप्रेशन ऑफ दैट सिम्टम बट नॉट द रूट कॉज रिमूवल फ्रॉम द सिस्टम. तो आप जैसे कह रहे हैं कि लेट आपके पास लोग आते हैं रजिस्टर जब उनको होता है कि चीजें काफी हद से बढ़ चुकी है. एंड देन अगेन लाइक द पॉइंट दैट आई वाज मेंशनिंग कि एक न्यूरोसर्जन के पास जाना इज लुक्ड एट फ्रॉम अ एंगल ऑफ अरे पागलपंती तो नहीं हो रही है. तो ये जो टैबू है सोसाइटी में, तो वो हम कैसे चेंज कर सकते हैं? इट्स ओके टू बी जस्ट लाइक अ टूथ, जैसे आपका दांत में दर्द होगा तो आप डेंटिस्ट के पास जाते हो, तो वैसे अगर आपका कुछ नर्व सिस्टम में विच इज अ बॉडीली पार्ट, अगर वहां पे कुछ चीजें सिम्टोमेटिक है, वी शुड गेट ट्रीटेड. ये एक सिंपल सा थॉट है.
सो देयर आर टू थिंग्स. वन इज आई वुड से लैक ऑफ अवेयरनेस एंड वन इज अ फियर ऑफ बिग थिंग. Because neurosurgery is related to life changing things.
Yes.
People are scared कि अगर मैं उनके पास जाऊं और कुछ गलत निकले तो. बट मुझे यही एक बताना जरूरी समझता हूं कि अगर कुछ निकला तो, अगर जल्दी निकला तो उसका सही इलाज पॉसिबल है. अभी न्यूरोसाइंसेस इतना एडवांस है कि देयर आर 90 to 95% ऑफ द डिजीजेस आर reversible.
Wow.
May not be curable, but
reversible.
at least they are reversible. And lot of diseases which have option of treatment, multiple treatment options, not कि एक ही operation, ये एक ही इलाज नहीं है, उसमें there are lot of things which can be done.
So surgical and non-surgical both.
Definitely there are multiple options. So अगर आप उस पे diagnose ही नहीं करोगे तो आप definitely trouble में रहोगे. Second, unawareness. Unawareness means lack of education. कि किसी को फीट आ रहा है और हम बोल रहे हैं कि ये फीट आना भगवान की देन है, देवी आली अंगा इन मराठी थिंग्स आर देयर. तो ये एक लैक ऑफ अवेयरनेस और एजुकेशन का पार्ट है. तो देयर वी वांट कि पेशेंट शुड नो दैट अगर फीट आ रही है, हाथ में झटके हो रहे हैं, अपरोलिंग हो रही है, तो ये गलत है, इसको डायग्नोज करना है. वैसे ही जैसे मैंने अभी बताया कि ओल्ड एज है, यूरिन पास हो रहा है, इम्बैलेंस हो रहा है, मेमोरी डिस्टर्बेंस हो रही है, ये तो बहुत कॉमन सिम्टम्स है ओल्ड एज में. लेकिन क्या मेरे पापा 2 महीने पहले ठीक थे और अभी ये सब चेंजेस रिसेंट हो रहे हैं? अगर ये ड्रास्टिक चेंजेस है तो यू शुड ट्राई टू डायग्नोज. देयर आर लॉट ऑफ डिजीजेस व्हिच आर एटलीस्ट controllable even if not treatable. There are like Alzheimer's, Parkinson's, these are medical diseases which are controllable. Then there are a lot of treatment options which are available for these kind of diseases. There is normal pressure hydrocephalus which can be completely cured with the surgery or non-medical management also. So definitely अगर आपको पता है कि कुछ deviation हुआ है तो बिना डरे एटलीस्ट डायग्नोसिस पे हमको पहुंचना है.
जी. Okay, sir, you just mentioned Alzheimer's and Parkinson's. आपके प्रोफेशन में और ऐसे क्या क्या डिसीजेज जो आप एनकाउंटर करते हैं?
सो जनरल पब्लिक के हिसाब से न्यूरो साइंसेस मीन्स ओनली ब्रेन. तो यहाँ पे एक समझने की जरूरत होती है कि इट इज नॉट जस्ट अबाउट ब्रेन, इट इज अबाउट स्पाइनल कॉर्ड, नर्व्स एंड द मसल्स. सो ये कंप्लीट सर्किट होता है कि एक चीज दूसरे थ्रू को कंट्रोल करती है, दूसरे से तीसरे पे जाती है.
राइट.
तो एज ए न्यूरोसर्जन और न्यूरोलॉजिस्ट दे सी द डिजीजेस एसोसिएटेड विद द ब्रेन, स्पाइनल कॉर्ड, नर्व्स एंड द मसल्स. अभी जब ब्रेन की बात आती है तो देयर आर वेरी कॉमनली वी नो स्ट्रोक और पैरालिसिस.
राइट.
देन इट कम्स ब्रेन ट्यूमर्स, देन हेड इंजुरीज, एक्सीडेंट्स, बिकॉज यंग लोगों में अभी बाइक और स्पीडी व्हीकल्स इनका बढ़ा हुआ है, तो हेड इंजुरी, लॉट ऑफ पीपल दे कम विथ हेड इंजुरीज. देन देयर इज अ कंडीशन कॉल्ड एज ट्राइजेमिनल न्यूरल्जिया, where there is a severe pain in the face because of the irritation of the fifth nerve. तो ये कंडीशंस पेशेंट्स डेंटल्स के पास जाते हैं, ईएनटी सर्जन्स के पास जाते हैं, बट दीज आर अल्टीमेटली रिलेटेड टू द न्यूरो एंड द न्यूरोसर्जिकल.
लोगों को पता
भी नहीं होता है. फॉर योर नॉलेज, डॉक्टर सलमान खान हैड दिस ट्राइजेमिनल न्यूरल्जिया एंड ही हैज बीन ट्रीटेड फॉर दैट. So Salman Khan, just out of the curiosity, is a best neurosurgical example. He has aneurysm, he has a trigeminal neuralgia, and he has taken the treatment and he is doing well. He is doing active life. So neurosurgery is something which can give you active life without any disorders or deformity. So that is what we should understand and try to get the diagnosis as again my specific point. Then when come to the spinal cord, slip disc, most common, young people, active life, bike riding, weightlifting, and suddenly having a catch in the back. So slip disc.
Even the sedentary life that we are actually going through.
Yes. So slip disc is a whole big topic. Again, why slip disc has increased now? Just because of the use of laptop, computers, no sports.
Correct.
Ground sports, back becomes weak. Continuously we are sitting, and suddenly after every weekend we go to trekking and gym once a week, and you think your back can give you all the strength that is required. So it is not possible. You need to train your back, take the activities, and then these things we can be controlled. Then coming to the spinal tumors, a lot of spinal cord tumors are there which we can operate or do the management. Then there is a infections like tuberculosis in the spine. It is the second most common after the lungs. The most common tuberculosis is seen in India also, I would say. So spine tuberculosis is very important topic which we have to address. When it comes to nerves, nerve sheath tumors, nerve injuries, nerve entrapments, carpal tunnel syndrome, these are the things which we do. Many of the people, they don't realize that nerves are related to the neurosurgeon. Sometimes they go to orthopedic surgeon or they go to physician, and then they refer us the patient, and
correct.
the time is wasted in the loop. So
It
identifying
will take a time.
yeah. So identifying the problem and addressing it properly is very important.
Right. Thank you so much for the detailed understanding of different diseases. But then, how do you break the news that boss, आपको ये हो सकता है? Because it's a very tough job to kind of handle patients and break the bad news to them. How do you handle that, sir?
So again, here India is a diverse country, I would say, and a lot of people have a different emotions, a different understanding about the problems. So conditions like brain tumor shatter your life and they break you from inside. So ऐसे condition में जब हमको patients को reveal करना है, so usually first I try to get information about the patient from the relatives. I try to understand how his nature, how is his lifestyle, how confident he is to go through the process. Because taking the patient in the confidence during the treatment is very important as a neurosurgeon for me. So first of all, I try to understand the psychology of the patient, and then I try to be empathetic towards the patient. You have to give the facts. We cannot hide any facts from the patient, giving a false hope. But still, we have to be very empathetic. It is not that you just tell on face that you have a brain tumor and you have only 1 year or 2 years to live. That movie kind of dialogues are never acceptable in real world. So you have to be very empathetic. You have to be very genuine to the patient.
At the same time, realistic.
Yes, and you have to tell the facts. So that things are very important while breaking the news.
How is the acceptance in terms of both from patients and the family of the patient? Both.
See, everyone has a shock first. You have to just make them understand how to bear the shock and how to go through this journey. I always tell my patient that this is a journey where end results we don't know. We have to follow the journey, and I am with you for this journey. So there we have to be very empathetic, as I told you. If we are going for the surgery, what are the prerequisites for the surgery? What are the expected course of treatment during the hospital stay, and what is expected after the hospital stay? Even spine surgery, for that sake, it is not just about the surgery and you go home and you are all okay. There is a rehabilitation, there is a physiotherapy sessions which you have to do, and you have to come back to normal again to your back. It is not just about the treatment of the disease, it is coming back to your normal work and working condition. Till then the treatment is not end.
Correct. But usually how much time after surgery a patient usually takes to kind of get back to the normal
life?
Again,
now this depends upon individual patient and kind of disease he is going through. But usually I say any surgical patient by 3rd week should be definitely normal to his routine basic activities like spinal spine surgeries or any tumor. He should come back to normal depending upon the pre-operative condition, and then we give them physiotherapy and rehabilitation. Usually it goes to around 3 months, I would say.
And what are because it's a brain surgery and again there is a risk involved. What are the chances of, say for example, you're treating say a tumor and then something happens and say the ability to speak properly, fluently, that kind of is hampered a little bit. Maybe that has happened. There are such cases.
So again, the world has and technology has evolved so much that now we get investigations before the surgery, MRI, localizing the exact site of the tumor, size of the tumor, which are the fibers which are getting, this is called a tractography in the technical language. The tractography tells us where are the hand areas fibers, where are the legs area fibers. Even there is a functional MRI which can actually diagnose where is your speech area, where is your other association areas in the brain. And once you have all this information, you can plan the surgery accordingly. We have done surgeries that is called awake craniotomy.
Yes, I was
awake craniotomy in that patient is talking, speaking to us during the surgery.
Right.
He is completely awake. He is moving hands. He is moving legs. So we actually know that we are doing the tumor resection, and still the patient is having adequate power. There is no deficit. If patient feels that there is any numbness or any deviation, he immediately informs us, and we can do the surgery depending upon the findings. Also, there are technologies of intraop monitoring. So intraop monitoring is a electrical awareness about the brain and the circuit going through the spinal cord to the nerves and the muscles. So this is called as MEP, SCCP monitoring, even facial nerve monitoring. These are the things which are possible, and it is available routinely in
So
the
this is
Thane.
using the electrical impulses.
Yeah, it is understanding the electrical voltages that are going through the brain into the spinal cord,
Wow.
into the nerve, and then into the muscles.
Wow.
So these are these are the tests. Now, for you as a common person, you know how to understand the heart condition. It is a ECG.
ECG. Correct.
But what is about the brain? So there is called a investigation called as EEG, electroencephalogram. So that can understand the brain's electrical impulses. Similarly, for nerves, there is a nerve conduction study. Similarly, for the muscle, there is a MVP.
Okay.
So these are different tests which are possible from brain to spinal cord to the nerve to the muscle again.
And all these technological advancements are available at Solaris Hospital?
Yes, these are tests which are done routinely at Solaris Hospital and many other hospitals. I would not say just for Solaris, but these are not, people are not aware about these things, that these are available, and you should take the advantage of this, and we should investigate in that way.
Right. Sir, you said injuries due to accidents, especially head injuries, and of course with the advent of the traffic and advent of new bikes that are getting manufactured, where speed is the only selling point. Youth is kind of losing they're not wearing helmets as well, they're breaking traffic rules. If they're wearing helmets, they're not ISI approved, and lots of problems are there. So is that ratio of those head injuries due to accidents, car or motor vehicle related, is it on the rise?
Definitely, head injury has been on the rise, and it is very concerning for me as a neurosurgeon, because it is not just about the patient. Head injury is something which is affecting the young in your family, and whole family is getting affected. It is most of the times earning member of the family, or it is who is young generation, and lot of expectation and long life is expected from him, and those age groups are usually affected from 20s to, I would say, 30s,
and especially
35s.
So there was a study which basically was revealing that most of the Swiggy or Zomato people who visited delivering, within 30 minutes span, they have to rush.
So this is again rushing time, having stress in your back, your reflexes are not coordinated, you don't know, you want to rush to a place fast, the brake systems are not there, helmets are not there, they have not the proper bikes also available. Plus
the road structure is also very full with potholes, so I mean, accident is bound to happen, and people are not being conscious about what's going to happen if they go into such kind of things.
So most important thing here is not just about your head injury. It is about the family and the background which I have seen patients who needed treatment for more than 1 month or 2 months just because of the head injury. They are in coma, they are not responding, they are on ventilator. The family don't have financial support, they have to sell their homes to earn and give these things. And all this because he is the main family earning member of the family, and patient is of no, it's not about just patient, it is about the family which is going to collapse after the accidents.
आपने बहुत ऐसे किस्से देखे होंगे जहाँ पे जैसे आप कह रहे हैं कि फाइनेंशियली ट्रबल बहुत होता है सारी फैमिली के ऊपर, क्योंकि एक तो सोल ब्रेड विनर होगा फैमिली का, या फिर एक क्रूशियल मेंबर होगा फैमिली का जिसके ऊपर दे डिपेंडेंट, राइट? सो अगर ऐसे केस में जब अर्निंग मेंबर ही इंजर्ड हो जाता है और फाइनेंशियली दे फैमिली इज नॉट इन अ पोजीशन, तो कैसे टैकल करें? इज देयर एनी फाइनेंशियल इंस्टीट्यूशन दैट सपोर्ट सच काइंड ऑफ ऑपरेशंस? दैट
so lot of NGOs who are coming forward now, even I would say Chief Minister Relief Fund is doing a lot of good work. They have updated their system, and when the patient is admitted, we just have to submit 3 documents from the patients, like Aadhaar card, ration card, income certificate, and a letter from treating doctor regarding what is the condition and what is expected outcome. This system now is so advanced that patient, when in the hospital, the patient gets financial support from the government during the treatment only. Definitely there is a limitations, complete treatment cannot be done under only Chief Minister Relief Fund, but definitely it is helping a lot to the poor people. And a lot of NGOs like Siddhi Vinayak Trust or other trusts which are coming forward, being human, they are giving support to the people who need like cancer surgeries. Definitely.
Thank you so much for giving us this aspect, sir. Very important. Now coming to the part where we have encountered cases where I've studied where you've done the surgery without opening the cranium through nose. What is that surgery called, sir? What is it about?
So there is a tumor called as pituitary adenoma. So basically, it is a master gland of the body which controls all the hormones of the system.
Okay.
And when there is a tumor, patient may have a visual disturbance or hormonal imbalance. These kind of tumors which are located between the two nerves of the eyes and vessels like ICA, इनके जगह के बीच में वो ट्यूमर होता है और ये ट्यूमर स्कल बेस के नीचे होने की वजह से नाक से ऑपरेट किया जा सकता है, जहाँ पे हमें ब्रेन ओपन करने की जरूरत नहीं होती। वैसे ही बहुत सारे ट्यूमर्स मेनिंजियोमा एंटीरियर स्कल बेस में जो होते हैं वो हम नाक के द्वारा ऑपरेट कर सकते हैं, जिसमें हमको स्कल बेस ओपन करने की जरूरत स्कल ओपन करने की जरूरत नहीं होती है। तो एंडोस्कोपिक सर्जरीज इज वेरी एडवांस नाउ। इवन इंट्रावेंट्रिकुलर ट्यूमर्स, इंट्रावेंट्रिकुलर biopsies can be done through small 1 millimeter hole in the skull, and then we can do, because we have a navigation system. A navigation system is one of the recent advances that we have added in the Solaris Hospital.
Okay.
Navigation system is a GPS kind of a thing. It is not actually live, but it can, a pre-operative MRI or a CT scan of the patient can be uploaded on the computer, and this computer guides us during the surgery where exactly the tumor, how deep it is, how medial or lateral, how thick it is, whether during the surgery have we removed the complete tumor or not. Even in spine surgeries, it is very advanced now. Like in spine fixation, when we put screw in the spinal vertebral body, it guides us how deep we have to go, how medial or lateral, how we can avoid spinal injury. So these are the technical advances which makes our job as a surgeon much easier, and definitely it improves the outcome of the surgery.
Correct. So you mentioned about coma, right? And there is a term called as brain death. So what is brain death?
So basically, brain is someone who is controlling whole body. There are few conditions where the response from the brain is not there, but the cardiac control is there.
It's still there.
Right. So in layman's language, I would say it is basically in India, we do not declare someone dead unless the heart stops.
Okay.
In foreign countries, there is a provision called as brain dead, which can be declared as a dead.
Okay. So
basically, brain dead is a concept which came for organ donation and not the treatment. When a person, because of any brain condition, goes in a situation where he is a brain dead, he is eligible for organ donation.
Right.
So awareness about brain dead and organ donation is very much important, because you can save at least 5 lives from these kind of patients available. It is a condition where brain is irreversibly damaged. When I say irreversibly, means there is no chance that this patient can come back again to a normal consciousness. There are a lot of clinical tests. There are some mechanical understanding like ABG. We do a test bedside during this patient, where we disconnect the ventilator and check his FiO2, and before the disconnection and after disconnection. Then there are CT scan angiograms, brain angiograms, which we are do if there is no blood flow in the brain and still the heart is beating and pulse is there. So these kind of patients which can call a brain dead kind of a patient.
But then do brain dead people, for example, any patient is brain, so on arrival that person is brain dead, do you admit that person? That's one. And second, because if you know that there is no chance of reversing the condition of brain death. Secondly, if the person becomes brain dead during the course of operator, how do you convey the message to the family?
So this is a gray zone. Definitely, it is very debatable, and patients have misconception here. Patients feel that I have been cheated, or someone who is kept on ventilator, already dead patient who is kept on ventilator. But here we, as a neurosurgeon or neurologist, try to give transparency. Transparency in terms of outcome. Whether this patient is going to recover or not recover.
Right.
Whether we expect a quality of life from him or we don't have any quality of life. Because it is not just about life saving anymore. It is about quality of life which we can offer to the patient after the treatment.
Absolutely.
So definitely as a neurosurgeon, I try to give that clarity to the patient that definitely ये अभी वापस नहीं आ सकते. अगर बचे तो भी एक ऐसे कंडीशन में बचेंगे कि जहाँ पे पेशेंट वेजिटेटिव हो सकता है या फिर वेंटिलेटर डिपेंडेंट हो सकता है या इनका लाइफ आईसीयू में एक्सटेंड हो सकता है. So we have to give the option to the family because we are not someone who can decide everything. We have to come to a single page with the discussion to the family whether we want to go to the aggressive management or supportive care, or we want to do a palliative care, or we want to do a de-escalation. Definitely, as per Indian law, once patient is on ventilator, we cannot disconnect the ventilator as per the law. Because that is the basic life requirement.
Right.
So patient and relatives has to be made understood about the situation, and then we have to be on common page and take the things forward.
But then there is something called as mercy death. When the patient, there is no chance of reversing the conditions for a patient, but the financial burden for the family also goes on and on.
Yeah.
And you have to take that practical call. I mean, I understand the emotions behind making a person be on the ventilator, and again, it's a pain for that person on ventilator as well, right? So the mercy death as a concept is not legal in India, if I'm correct.
I think one of the case recently who are allowed for mercy death.
Right. But so, as a general concept,
as a general public, as I told you, this is a very debatable and gray zone in medical practice.
Right.
Because this can go wrong also. So definitely, as I told you, if a person really feels he needs a mercy death kind of a thing, I think our laws are very good. Our legal team is very good, and we have to trust them, and we have to follow that procedure.
Right.
After the orders from the court, definitely these are possible, but it is not just a doctor who can decide about the mercy death.
Right.
It has to be a legal procedure, and we have to take all the aspects in on writing, and then only go for this thing. When it comes to de-escalation, Indian law allows you to stop the treatment. So in this case, what we as a clinician can do, that we can give patients basic requirements like feeding, ventilator, oxygen. These are the basic things which we cannot stop.
Correct.
We can take the consent from the family regarding the higher and costly medicines.
Right.
We can stop or de-escalate depending upon the need discussion of the family. So this can take care of financial burden also, and this can also help patient that we are not doing injustice to any patient, and we are not doing anything wrong to the patient.
Right. Coming to a lighter topic now, sir. You mentioned the usage of technology initially in the video. So I want to understand how AI and technology will help patients get better. Are there any medical advancements right now in the field?
See, definitely AI is helping all the medical fraternity in terms of diagnosing, treatment, and making people or the patient aware about the latest technology. As far as neurosurgery is concerned, lot of researches are going on in the investigations of like MRI, as I told you.
Right.
3D reconstructions which are going on, neuro navigation, as I told you, where we can put a pre-operative MRI into the system, and then that guides us. Now there are a lot of robotics which are coming, where the robots are being helped during the spine surgeries, where we put the screws. But it is not that completely it can go on the AI, or completely it can go on the robotics thing.
Right.
It is the human who controls the technology. So it has to be a balanced system between technology and understanding about use of technology.
Right. And what are the technological advancements that we are using at Solaris, sir?
So Solaris, as I told you, we have a neuro navigation system. We have endoscopic advanced system. Then we have a CT scan which helps us pre-operatively get the 3D reconstructions about like cases of aneurysm or tumors, where we can actually plan according to the depending on location, size, shape, which approach we have to do. Then endoscopy, as I told you, we can do burr holes and do surgeries. We can take biopsies in awake patients, like patients are talking, moving hands and leg, and still we are doing the neurosurgery. Then intraop monitoring, as I told you, where we can monitor from brain to spinal cord to the nerves to the muscle continuously during the surgery. We like vestibular schwannoma tumor, which affect the facial and the hearing. we try to preserve facial nerve and preserve the function of the patient, and then give him quality of life he deserves.
Understood, sir. Thank you so much for enlightening us about that. Now, coming to a topic which is, of course, government backed as well, which is tourism in India. Now, there is something called as medical tourism. People all over the world find that expenses, which are medical expenses, which they would otherwise have to kind of pay abroad, are far lesser in India. Plus, the technological advancement, like you mentioned right now in Solaris Hospital, that there in India, many hospitals are actually doing this. Solaris is one of them. So, how do you see medical tourism? Do you get patients from abroad as well?
So, medical tourism is definitely one of the key achievements of India, I would say. India is a leader in medical field, not just in technology, but in terms of experience, skills, knowledge. The doctors here who are available in India are far much knowledgeable and experienced because of the numbers. Now we say population, but population indirectly helping the medical field to learn about the diseases. We are ready to fight any new diseases faster than the Western world because we have the numbers. Technology wise, India is far much improved and cost effective treatment options are available. We can do the surgeries which are possible in US or in outside in lesser than, I would say, 20% cost.
Wow.
So that much difference is there. And we also are able to give the better results in terms of outcome.
In terms of hospitality also,
yes.
we are very well.
Indian are always good at hospitality. Not just about the treatment, but other aspects like food, tourism. These are
and nursing for that matter. Because I think a lot of examples have been given of Indian nurses going abroad and taking care of patients.
Yes. So Indians are empathetic towards their caregivers. So that is what really attracts. We are not very professional or to the face kind of a people. We have been trained or sanskar je म्हणतो आपण. We call this sanskar je hai te we try to give, not take from the patient.
Absolutely. So life expectancy has changed, as you see, and we have a huge population that is now in the young generation. So we are the youngest country right now on planet. However, life expectancy that has increased for most of us, that brings new challenges in terms of diseases. So what sort of diseases that you are seeing, and the change that you're seeing, say from heart diseases or cancer, or maybe say neurological disorders? What is your observation?
So basically, I always say there was an era where first we were difficult to tackle the infections. The population were used to get swapped out because of any infections like plague. Then there was a situation where cardiac conditions, heart diseases were very rampant. Then there was a situation where cancers have taken care, lot of cancer diseases which are killing the patients, but each human have a tendency to fight back, find the answers to the questions, and because of that every time we could come out of this. And now the biggest challenge is geriatric population. The geriatric population above 60, the life expectancy has gone to 70, 80 now. And these patients, they don't have problems with the disorder, but they have problem with the quality of life. We don't want to live just like a robot. We want to live life healthy and functional. So for that, I would say we have to find what are the problems of geriatric public. Many of them want to be ambulating, mobile. They want to go to the trekking. They want to go to tourism. They want to have a functional life. So these kind of disorders, they hamper their quality of life. As I told you, Parkinson, Alzheimer's, normal pressure hydrocephalus. These are the neurological conditions which usually affect your quality of life and make you bedbound or homebound, and need to diagnose these. And these are, many of them are treatable. Like normal pressure hydrocephalus, where there is accumulation of water into the brain, and then that causes your frontal lobe under pressure, and patient cannot walk. His walk becomes slow, steps become small, urine control is lost, his memory is disturbed. Things which he used to remember 3 months back or 6 months back, he is not able to remember now. So these are
this typically happens in patients
old age. And many of times we say that nahi माझे आजोबा आहेत हे विसरायला लागलेत, पण we don't put attention to that.
We ignore it actually, saying
yes,
ये तो बूढ़ा
normal. But if this is possible and we diagnose this, there is a test called as TAB test, where we remove water from the spine around 40 to 50 ml, and if that comes positive, there is a permanent solution called as ventriculoperitoneal shunt, where we put a shunt from the brain into the abdomen. We divert that excess of water, and patient actually next day we can see that there is an improvement in the walk, gait, urine control, or some patients may also improve the memory immediately, or some may take some time, but definitely this can change the quality of life of the patient. The oldest patient I have operated for these kind of conditions were 92 years.
Wow.
And 92 years he had a again improvement, and family was willing that we don't want patient to be on bed, and we are doing everything, sir. We want patient to be active. At least he should go to toilet, he should take care of his own life, food habits, everything. So that is what had changed now. We want quality of life over just a life.
And the post-surgical operative. So when you operate any person for that matter, there is a recovery period, and it is a general misconception, I would say, that old age people should not get operated because the muscles will not, the body will not heal faster, and there could be complications. So is that true, sir?
See, definitely there is a difference of young population and geriatric population, but there is a way of handling the situation. Any patient who has a cardiac mobility, whether we can minimize the risk of anesthesia, whether we can optimize the patient condition, that has to be taken care. As a surgeon, I don't say कि old age patients immediately we have to go for surgery. We have to understand his capabilities, his limitations, and take the things forward. We can change the pattern of anesthesia, we can change the pattern of surgery, we can change the techniques of surgical depending upon the age. The aim here is not the complete cure. The aim here is the quality of life. So changing approach according to each individual patient is very important.
आप जो कह रहे हो बहुत सही कह रहे हैं. I think people need to understand that कि quality of life, कहीं फिल्म में डायलॉग था कि जिंदगी बड़ी, राजेश खन्ना का डायलॉग था उसमें, आनंद पिक्चर का मुझे याद है कि जिंदगी लंबी नहीं बड़ी होनी चाहिए. तो ये क्वालिटी ऑफ लाइफ एक्चुअली मीन्स द सेम थिंग. एक्चुअली आई कैन रिलेट टू दिस कि सिर्फ उम्र बढ़ाने से या फिर सिर्फ लाइफ एक्सपेक्टेंसी बढ़ के अगर आपको एज अ वेजिटेटिव आपको बेड में रहना है तो उसको उस लाइफ का क्या होगा?
So here now the surgeons who trained, they are trained in such a way, I would say, it is not कि you have to boost your chest that I have removed a complete tumor. It is not about your job. It is about the patient. Even if you remove a 90% of the tumor, 10% tumor is left, and you are able to preserve the quality of life of the patient, that is more successful surgery rather than you remove 100% tumor and give paralysis to the patient. So as a surgeon, the technique understanding about the situation is now different. It is not about you as a surgeon, it is about the patient. Now how the patient want to live his life and how we can give him good quality of life rather than just complete cure of the disease.
Correct. Important. So one more question which is linked to children now. बहुत सारे बच्चे होते हैं, उनकी मतलब इतना कॉम्पिटिटिव वर्ल्ड आ गया कि शुरुआत से 4th स्टैंडर्ड से उनकी स्कॉलरशिप एग्जामिनेशन, 7th में कुछ और एग्जाम, फिर 10th, फिर 12th, फिर अगेन मेडिकल टेस्ट, बहुत सारी टेस्ट होती है, MBA की एंट्रेंस की एग्जाम होती है. उसमें ऑफ कोर्स हमारा थोड़ा सा एजुकेशन सिस्टम भी थोड़ा सा ऐसा है कि जिसमें हमें रट्टा मारने के ऊपर, थोड़ा मेमोरी बढ़ाने के ऊपर ज्यादा फोकस दिया जाता है, बिकॉज यू हैव टू मेमोराइज अ लॉट ऑफ थिंग्स, फॉर्मूले एंड एवरीथिंग, राइट? सो हाउ टू इंक्रीज मेमोरी? इज देयर एनी सॉल्यूशन, सर?
So here, first of all, you have to understand brain is such a powerful tool, or the organ you have. It has enormous, and any intelligent person who uses his brain is not more than 10%. It is said that even his brain is 90% unutilized.
Okay.
So there is no limit to your memory. First of all, where we do the mistake is about the attention. Most of the students or young children, they do mistake at the attention. When your attention is good, your memory improves.
So all these meditation and everything are to improve your attention span.
Yeah, attention span. So attention about self-awareness, about the surroundings, about the things which you experience in your daily life. We say that it is just about eyes, ears, but it is about touch, it is about taste, it is about smell, and there is a sense called a sixth sense. So definitely memory, subconscious mind is always going on when you are not understanding, and it is stored. The memory is also a long-term memory, a short-term memory, even as I told you, physical experience memory is much more lasted rather than just technically you read the books. And so when you read the book, you memorize that you are in that situation, you dream about yourself being in that situation, you memorize that part or that story as a you in that. So your memory becomes more strong. So try to give multiple aspects to your study. For children, I always say that don't try to mug up. When you say you mug up, you are just using your tongue and your ear.
It's
But
a
you are
muscle
not,
memory.
yeah, it is a muscle
Short
memory.
term.
It is short term memory. But when you try to make some multiple things like play with children, showing them 1, 2, 3, now you have to जसं की तुम्हाला पाढा बोलायचा आहे
हा.
2चा, so bring some objects, make them play with those objects.
काहीतरी
If they
वेगळं create
play,
करा.
they play with that, they will start remembering. You do different things. It should not be a uniform, just books and handwriting. All those things. Definitely, Indian education system has the limitations, and we need to improve. And it is improving. I think the government is also understanding, and I think future is expected to change some educational patterns.
Sir, you mentioned short-term memory, and my mind directly goes to the movie called as Ghazni, in which Amir Khan has a short-term memory loss, and he does not remember it beyond any 10-15 minutes of time span what has happened. He has all the tattoos. The short-term memory loss, also there is a medical term for this disease. I'm not...
No, see, definitely there is this short-term memory loss, but what is shown on the movie is more dramatic than the reality. It is not that patient definitely in time 15 minutes he remembers and 15 minutes is again back. It is not time bound. Definitely you have memory issues. There are different sorts of memory centers in the brain, short term and long term. Even your experiential memory, emotional memory is different. If you remember at when you are 2 years old and you had some snake in front of you, or you are scared, you will still remember
it, yes.
After 20-30 years.
Right.
It is emotional because you had a fear. So emotional memory is very different compared to the mechanical memory.
So what you're saying is whenever those core memories get activated,
yes,
the brain basically remembers everything.
So it has to be a multifactorial, as I told you. It should not be when you want to remember something, don't just mug up the things. You try to accumulate that as a sense of understanding, fear, or attach some emotions to that. Indirectly you get remember everything.
Absolutely. सर एक और क्वेश्चन है, ये जो हमें ब्रेन ट्यूमर्स जो होते हैं, what are the causes? Is there a specific cause कि इसके से brain tumor होता है?
See, to be frank, definitely it is not directly linked to any specific cause, but definitely for all cancers in the body, the smoking, cancerogenic chemicals, radiation has been told, but no direct one-to-one connection has been found. Some genetic factors are there, or genetic misregulations which can happen, which can cause this kind of a tumor. And now tumors are diagnosed not just about the biopsy. They go on the genetic analysis of the tumor, and then ISC markers which are come now. The WHO guidelines have changed to diagnose and categorize the tumors now on the genetic findings. Okay. So now the detailing has occurred, but to say that it is one-to-one, there are very few tumors which can be directly related to the hereditary or genetics or one-to-one connection.
So one area you said it's a genetic disorder. It can be passed on through.
There are few cases which can pass, but not all the tumors. Again, there is a misconception that not all tumors. If I have a tumor, then it will go to the family. Nothing like that.
But the markers will be there, which can probably cause.
Yes. So genetic analysis is possible nowadays.
Right. Karyotyping.
Karyotyping.
Secondly, there is lifestyle that has changed. So the external factors, including genetic lifestyle changes, do they impact? No. Again,
known lifestyle changes will directly impact your brain health, but definitely compared to the recovery phase, if you call me, the recovery phase will be affected, not the directly related to disease.
So the stress, sleep mismanagement, all these things will not.
No. So, but yeah, if you ask me what is the best medicine for the brain, I would say sleep. So sleep is one of the time condition where the brain heals itself best.
Correct.
and you give the rest to the brain, next morning you will be more fresh, more alert, more convinced to do the things. So sleep is very important. It is not that it is it will, if you don't sleep you will have problem, you will be stressed, your concentration will go, your attention span will reduce, so it will affect your quality of life. But if you sleep properly and you take adequate sleep, your brain is fresh, your outcome will be doubled, I would say. So sleep is most important medicine for the brain.
Absolutely. So, couple of more questions now that we are talking about sleep. What are dreams? I mean, how do the dreams? How do
Again,
people
ये
dream?
कोई को लोचा है भाई, जैसे बोलते हैं, it is not the fact. These are the hormonal changes or chemical changes which are happening in the brain. I would say hippocampus is one of the region where we have emotions, we store emotions, and when you are sleeping, your subconscious mind, these chemical reactions again reaggravate and get you those thoughts in your brain. So here medical science has limitations, I would say, with regards to mind. And here we say that Adhyatma or our Sanatan Dharma has more understanding, as far as my understanding, where you have to understand your subconscious mind. So you need some more detailing. Yoga and other things may help in doing that.
But medical science still is
under the research, and definitely there is no proven mechanism or proven one-to-one thing with regards to subconscious mind.
Sir, one question that everyone wants to know from the audiences is how to heal your brain, how to recover from all the damages, all the stress, how to de-stress yourself and get back to the normal life that you want yourself to be.
So, as a neurosurgeon, मैं हमेशा ये कहता हूँ कि दिमाग है तो जिंदगी है, दिमाग ही नहीं है तो फिर आपके हाथ पांव चलना, आपका मेमोरी, आपका बात करना, आपका खेलना कूदना, इवन खुश रहना, ये भाव आना, खुश हूं या दुखी हूं, ये सब भाव भी आपके दिमाग से ही आ रहे हैं जी. तो अगर हम बोलते हैं मुझे प्यार हो गया, नहीं, ये हार्ट का नहीं है, ये दिमाग का ही है. The brain is the most important organ of the body, master of everything. It controls everything. मेरा हमेशा ये कहना रहता है कि आपका हार्ट भी चल रहा है तो हार्ट का एक स्पेसिफिक सेंटर ब्रेन स्टेम में है कि जो हार्ट को चला रहा है. आप सांस ले रहे हो, सांस का भी एक सेंटर है दिमाग में, ब्रेन स्टेम में. अगर वो डैमेज हुआ तो आप सांस ले नहीं पाओगे. आप जिंदा हो लेकिन सांस लेने के लिए वेंटिलेटर लग सकता है, आप आंखें खोल रहे हो लेकिन वेंटिलेटर लग सकता है. आपका बॉवेल मोशन होने का कंट्रोल भी दिमाग के पास है, आपका यूरिन का कंट्रोल आपका दिमाग के पास है, आपके हाथ पांव का तो डेफिनेटली है, आपके बात का है. तो किस चीज का कंट्रोल दिमाग के पास नहीं है? राइट. तो हम सब चीज जिम में जाके बॉडी बना रहे हैं, सब कर रहे हैं, लेकिन कभी हमने सोचा है कि दिमाग के बारे में हम कैसे हील करें? तो स्लीप, मैंने बोला स्लीप ये सबसे बेस्ट मेडिसिन है. राइट. सेकेंडली टेक ब्रेक्स, एंजॉय, यूज योर हॉबीज. हम चिल्ड्रंस को बोलते हैं कि स्टडी के साथ हॉबीज होना बहुत जरूरी है, बिकॉज दोज थिंग्स विल हेल्प योर चाइल्ड टू ग्रो. राइट. जैसे कि ड्राइंग हो गया, सिंगिंग हो गया. हमारा लेफ्ट साइड ऑफ द ब्रेन कंट्रोल्स मेमोरी कैलकुलेशन, बट हमारा राइट साइड का ब्रेन कंट्रोल्स creation of things like drawing, painting, singing, songs. All the creations are controlled by the right side of the brain. So balance होना बहुत जरूरी है, एक ही साइड का काम करके नहीं होगा.
And in terms of diet, is there any mineral rich diet or
so diet definitely dietitians will give you a lot of prescriptions, but I would say B12, D3, कैल्शियम, ये 3 विटामिन बहुत जरूरी है ब्रेन को हीलिंग के लिए.
And
मिनरल्स वही जैसे कैल्शियम, मैंने बोला कैल्शियम, मैग्नीशियम, ये सब इंपॉर्टेंट है. कैल्शियम जैसे कि कोई भी इलेक्ट्रिकल करंट कंडक्ट हो रहा है ब्रेन के सेल्स के थ्रू, इट गोज थ्रू दीज channels only. Right. So these vitamins are very important in terms of healing of the brain. Right. So diet में B12 supplements होना बहुत जरूरी है, क्योंकि नर्व्स के ऊपर का या फिर ब्रेन सेल्स के ऊपर का कवर बनाने का काम ही ये करते हैं. Right. और अगर ये डिफिशियंसी होगी तो डीमाइलिनेशन होने का बहुत चांसेस होता है. और ये पेशेंट्स सब अच्छा है लेकिन चक्कर आ रही है, बैलेंस जा रहा है, हाथ पांव में मूंगी आ रहे हैं, झुमझुम हो रहे हैं, एंड वी गिव फ्यू शॉट्स ऑफ B12 एंड दे सब ठीक हो गया. Right. So we need to understand our diet, our sleep, our habits, giving rest to the body in terms of एक्सप्रेस,
Right.
ये बहुत जरूरी है। हमारी ये कितनी भी बिजी लाइफ हो,
Right.
अगर आप अच्छे से छोटा ब्रेक लेंगे, यू विल कम बैक विथ डबल एनर्जी एंड ब्रेन नीड्स दिस ब्रेक्स।
That power nap that people recommend कि आप बीच में 15 मिनट का छोटा सा power
Yes,
nap,
yes,
I think
yes.
that is what you actually
Yes,
think.
yes, yes. I would not say just a nap, but it is individual understanding. It is not about day, it is not about night, it is not about 2 घंटा 4 घंटा. Some can have 2 hours of sleep and they can be fine. But how your body understands your brain,
Right.
that is more important. Where brain always gives a signal to your body कि कुछ गड़बड़ है, you have to pick up that, take small break, take rest. नहीं, मैं force करूंगा अपने body को, नहीं चलेगा. Body will hit back you again.
This brings us to the last topic of our conversation, sir. We'll play some rapid fire in which I'll ask about your personal experience.
Yeah.
Yeah. So the most difficult surgery that you have done so far.
Most difficult. It's very difficult. All surgeries are. I as a personal say, no surgery should be taken easy.
Yeah.
Every surgery, when I touch a knife to the patient, I consider it as to be much more important because it is changing the life of a patient.
Yeah.
So no surgery, I would say, very easy. Definitely every surgery, I remember every patient of mine I have operated. When I touch my patient, after 10 years, even if he visits me, I remember his face or I remember what I have done to him. So it is not possible that any surgery is difficult or any surgery is easy. Every surgery is same important for me.
If you were not a doctor, who would have been?
I don't know. I've never thought a doctor
But
was.
do you have any passions apart from being in medicine field?
No. To be frank, definitely surgery. Everyone says that I go to gym, I get what you can kick. I go to operation theater and I get kick. When I operate, I get good results. I see happy faces. I see patients' life is changing because of me.
Yeah.
That gives me utmost satisfaction. And definitely, I can sacrifice or I can put online anything than the success of surgical outcome or any patient's care.
And I think this is the only thought because of which doctors have a special place.
Yeah. Because I don't know right now. I never think I can. I don't. I like sports. I like reading books. But nothing is more passionate or nothing is more likeful more than the surgical field, I would say.
Your favorite destination for vacation?
I would say Kashmir.
Wow. सर बहुत सारे सवाल है बिकॉज लाइक यू सेड मेडिकल साइंस अगर ब्रेन को नहीं सोचा हम आम आदमी कैसे समझ पाएंगे सर. सो हम आपको वापस एक बार बुलाएंगे इस चैनल के ऊपर और आई थिंक विल स्पीक मोर इन मराठी. यस थैंक यू सो मच फॉर कमिंग इन सर. इट वाज अ ग्रेट प्लेजर टू हैव यू ऑन द पॉडकास्ट. थैंक यू सो मच. तो दोस्तों मिलेंगे एक नए एपिसोड में एक नए गेस्ट के साथ एक इंटरेस्टिंग टॉपिक लेके. तब तक के लिए अलविदा.